Hi, everyone. Happy New Year, if I haven't said that to you yet. We're super excited today for our topic with a back at 2025 and ahead to 2026. We have Dr. David Atchison with us, and so we'll get started soon. Give us 1 minute just so that we can have some of the other guests get on, and then we'll jump right in. See you soon. All right. I am so excited to introduce our guest. Many of you are already familiar with Dr. David Atchison. He is a medical doctor, having graduated from the University of London Medical School. He's practiced internal medicine for multiple years. Then he transitioned onto the food safety side, and having been the chief medical officer for the USDA and the FDA. He's published a lot of articles nationally and internationally around food safety and different regulations. Welcome, Dr. David Atchison.
Thank you very much. It's a great pleasure to be on FSMA Friday once again.
All right. We're going to toss it over to you around recent updates.
Absolutely. Well, there are a few, and some of them are pretty significant. Let's kick it off with the new dietary guidelines. Been waiting those for a long time, and they have clearly upended the pyramid as we figured that they would, and indeed they have. And the whole focus of the new dietary guidelines is very interesting. It's essentially focused on the quest to eat real food. And I was just looking here at how real food is defined, and I'm going to read this. And it is choosing foods that are wholly or minimally processed and recognizable as food, prepared with few ingredients, without added sugars, industrial oils, artificial flavors, or preservatives. So that's where we need to go. The other factor is that the dietary guidelines have shrunk from hundreds of pages to 10. So it's simple, it's straightforward. And yet behind that, there's about 500 pages of science, which I'm not going to get into. All right, so that's one big significant regulatory update. Number two, the Government Accountability Office, which you may not all be familiar with what that is, but it's a sort of independent government group that is tasked to go check on federal agencies. Are they doing what they're supposed to do? And often it's triggered by a congressional question. So the GAO was tasked to, how's FDA doing with FSMA requirements? And they didn't exactly get 10 out of 10 for that. And the GAO essentially focused on a few things that the FDA still needs to do, probably the most important of which was to finalize the traceability rule. So that was a GAO report. And then the last one I just want to mention is the increased listeria regulations. This sort of plays into our bigger theme for today around where's 25 been, 26 going. And there's a lot of things for us to talk about, but listeria is still absolutely front and center. And the regulatory update there is that the Food Safety Inspection Service recently put out an announcement that essentially, if you've got listeria species in your facility, you do need to take that extremely seriously. Now, many companies already do that, but they're basically saying, FSIS, is we're watching you to see how you react to the listeria species, not LM, but species findings in the environment. And they are wanting you to really dig in and to pursue those and take account of that in terms of risk control. Arguably, it's not that new, but it's the first time they've really come out and said it so explicitly. But again, it sort of puts the emphasis on the importance of listeria in ready-to-eat foods, and FSIS has picked up on that and are running with it. So that's just a few regulatory updates now.
Okay. Well, let's get into some of the questions that we have prepared. Team, can you pull down the slides? Thank you. All right, Dr. Atchison, in 2025, it was an eventful year for the food industry. And with the new administrating, promoting new ideology, making personnel cuts, right, focusing on the MAHA. Let's start our review of last year with your take on some major areas. So can we start with food artificial dyes? What initiated it? What effect did it have?
Absolutely. Before I get into artificial dyes, and I will in a sec, I think 2025 it was a year of headlines and sensationalism and forecast of change. in all sorts of areas that I'm sure we'll dive into, because food dyes is just one of them. But it's interesting to see how over the course of 2025, I think it started out with a great deal of noise and a lot of speculation and arguably some panic and fear in the food industry as to where it's all going to go. And I'll sort of preempt a 2026 thought there, Nye, and sort of comment that there's still a lot of stuff in motion, but to some extent, I think the noise has died down a bit. So part of what are we distilling? What are we really going to see going into 2026? Because 25 is done. And what do our listeners need to be thinking about as they're trying to understand how to navigate the risks in 2026? That's just a broad answer. Now, with regard to dyes, that's one of them. It was a clear focus: is get artificial dyes out of food. And I think there was a lot of sort of expectation that FDA was going to jump out there with a regulation banning artificial dyes. Well, they haven't done that. What the approach that they have taken is one of engaging with leading manufacturers that use colors in food and essentially trying to get them to voluntarily change. And I think, as most of our audience knows, that many of those leading companies have done exactly that. They've sort of said, yep, no, we get it. You'll regulate us to do this, so we're just going to do it. And my experience of working with companies that use food dyes is they knew this was coming and they've already thought about it. And they just needed a nudge. Now, where the gap was is, do you have enough approved natural colors that you can use in place of the artificial colors? And that was a little bit of a bottleneck. And FDA has now sort of got, has moved along and has got some of the natural colors that we were missing, some of the blues and the likes, that are now approved for use. So that is moving along. And there's been, I think, a lot of voluntary compliance to change. And I'm not, unless that slows down or change takes a weird direction, I'm not seeing a high probability that there'll be a big reg coming out on that, because it seems to have had an effect already. We'll see where it lands. We'll see where it goes. I won't rule out a reg, but I don't think it's a high priority one.
Yeah, and it is interesting because at least some of the other countries around the world have already pushed some of the artificial dyes out, and the public is focusing some of their priorities on how they purchase as well. Let's move on to, regarding last year, ultra processed foods. What is your take on that?
Well, that is one of the ones that I was alluding to in my opening comment about high profile, big splash items, and ultra processed foods was absolutely front and center. I mean, that was part of where 2025 went. Let me back up a little bit. It was heavily driven by the run up to the election. Prior to that, I mean, there was, as Kennedy was coming out there and saying all these things and where he wanted to go, and ultra processed foods was absolutely, that was a bullseye target. And I think that a lot of American consumers sort of bought into the notion of, we can see that the country's getting less healthy, however you define that, and that there's a variety of factors in ultra processed foods. Well, maybe that's a part of it. Now, where did 2025 go, and where's 26 going? Well, I think it was back in May in 2025 when the administration published a fairly extensive document around making America healthy again. And within that document, there were 3 or 4 large buckets of focus. One of them was ultra processed foods, but there were others, as the recognition that lifestyles and drug usage and even social media and interactions of all that were all playing into this, which got nothing to do with food. But the ultra processed food sort of got an element of prominence in there in the early parts of 2025. Then the next thing that happened with UPFs is that it sort of went into a notion of, well, we can't regulate it until we've defined it. So
right, that was going to be one of my follow-up questions if you didn't answer that.
Right. So it became well, we want to regulate it, but what are we going to regulate and how do we define it? So that sort of made me smile a little bit, because it's sort of like, all right, you start that game of trying to define it. And now who's going to set the definition? What's the level of agreement there's going to be? How long is that process going to take? And I liken that to the efforts over the years to define natural in foods.
Okay.
That's never been effectively defined from a regulatory perspective for FDA. They've never really sort of got their head around, well, what's natural versus not natural? And companies make natural claims and then they get themselves into legal trouble because, a consumer group says, well, there's an artificial dye in it, to go back to our earlier point. Therefore, it's not natural. Oh, it's not, okay, right. So there's a sort of a legal action. But when you get into the quagmire of trying to define ultra-processed foods, you immediately, I think, put the brakes on the whole thing. And I suspect that getting an adequate definition that will meet federal regulatory standards without legal challenge is going to take years.
Oh, okay.
I'm using the natural as an example of where it took years, people tried and they never got there. So I think that has essentially put the brakes on the whole process. That's just that's a David perspective. So it hasn't stopped. It's still a priority, but effectively it's been like, there's been such a sort of pothole created that we got to get across this pothole of defining it. And that is going to take a while. So it may yet happen, but it really has sort of slowed everything down. But it hasn't stopped.
Okay. So time will tell and how far they actually move forward with the ultra processed foods.
Yeah.
If we move on to self-affirmed GRAS took a hit. Can you talk about that?
Absolutely, it took a hit. Yeah, self-affirmed GRAS, or as everybody calls it, GRAS. It did take a hit. That was another one of the early 2025 promises as to go after that. Now, this one I put in a different bucket than the colors, which I think are taking care of themselves. The ultra processed, as I just said, is sort of on a slow boat to I won't say to nowhere, but to somewhere, but it's a slow boat. This is on a fast track, I believe that the GRAS is going to move. And I suspect the majority of our audience are familiar with GRAS, but very briefly, we're dealing with three different ways. You can be GRAS because the ingredient is pre-1958, and there's just a historical perspective. So it's grandfathered in. It's a ingredient that's been used for years and was grandfathered in. Then there is the GRAS process, where a company submits a package of information to the Food and Drug Administration saying they've looked at the science behind the risk and the usage of any ingredient and the way they plan to use it in a product.
Okay.
And there's a body of science to say this ingredient's history, the way we're going to use it, the amount we're going to use it, and the target audience, so a child, an adult, elderly, immune compromised. Look at all of those risk factors, and you create a GRAS dossier of scientific information about the risk, and you send that to the FDA, and the FDA reviews it, and they come back and they say, we don't have any questions. And that is the sort of the second process in which the science behind the usage and the risks associated with the ingredient has gone through an FDA review process. Now, it's not terribly official, but it means the agency has put their eyes on the science and given it the green light to go ahead. The third is the one you're talking about, is this self-affirmed GRAS. And this is where a food company decides to use an ingredient, and it could be a new ingredient or it could be an old ingredient, but they want to use it in a completely different way from a prior approval. and they look at the science internally, or they could use outside experts. They do not submit it to the FDA. And internally, as a company, they say, we believe this is safe. That's called self-affirmed GRAS. So that you've got these three parallels. You've got the history, you've got an FDA process, and you've got one which is a private sector process. And that private sector process, self-affirmed GRAS, has been a target for years. When I was at the Food and Drug Administration, it was a target then. And now it has become front and center. And
what do you think changed for that?
There's been an effort to try to change it for years. This is not a new initiative. I think what changed it was the whole momentum behind Make America Healthy again. And you look at the big buckets that Maher were trying to focus on. This was one of them that Kennedy jumped on, and he said, we need to change this. And I think it was, frankly, it was opportune. It wasn't new, it wasn't innovative, but it was there, and people had tried before to drive it. And he said, I'm going to take this one and I'm going to drive it. And he is. So I think self-affirmed GRAS is vulnerable.
Okay.
And let me just sort of wrap that by saying to any of our listeners who are looking at this, my recommendation to all food companies is to look at your ingredient lists, look at what you're using, and determine whether there's anything on there that you're getting from a supplier which has gone through self-affirmation. It's GRAS because somebody self-affirmed it. Because you can't use an ingredient unless it's either GRAS or an approved food additive. It's got to be one or the other. And if you're using an ingredient that somebody somewhere up the supply chain did a self-affirmation, there's an element of vulnerability that'll change, and it might impact the supply of that to you. So what do you need to do today is look through your ingredient lists, look at your supplier lists, and determine whether there's anything you're using which could be vulnerable. If a reg comes out saying any ingredient that's self-affirmed is no longer legal and you can't use it, that's a worst case.
Right. And I think in some of the other cases we've seen in the last year, some of the allergen recalls were likely tied to some of this, right? Where allergen was undisclosed in one of the ingredients a supplier might.
Well, that's a slightly different thing. We've now got 9 major allergens that need to be declared. That's not really related to GRAS, but it's definitely, if you have one of those allergens and it's undeclared in the product, then that's going to be adulterated and is likely going to lead to a recall.
Okay. So we also saw new direction on the public health side with a shift in vaccination and other health recommendations. Any thoughts there?
Yeah, I mean, you mentioned my background. I spent the first part of my career as an infectious disease physician. I saw a ton of value from the right kind of vaccines for the right kind of situations. I always think the poster child for vaccination, the success of it, is the eradication of smallpox. That was eradicated globally because of vaccines, no other reason. Polio, similar, it's not completely gone, but it had a huge impact. It's a topical question because I'm going to age myself here, but when I was a kid growing up in the United Kingdom, we didn't have measles vaccines. I had measles as a kid. I had chickenpox as a kid. Nasty itchy rash. I remember it. I mean, it was. So there was no vaccine, and then along comes measles and chickenpox vaccines and the like, and they really have they're very capable of reducing the probability that you'll get the disease, or if you get it, you'll get it in a much milder form. We've had this sort of vaccine rebellion that's happened, and unfortunately, all vaccines have got thrown out. I mean, we've thrown the vaccines out with the bathwater here, and it's having repercussive effects. Why is that topical? Because right now there's a measles outbreak going on in South Carolina, and it's significant. I think there's been 700 or 800 cases this year of measles. So I think I don't like vaccines that haven't been gone through proper, thorough clinical trials, and that takes time. And I think I'm not going to get political, but clearly there was a whole COVID thing where vaccines got a bad rap for whatever reason, and I think we're now paying the price because the good vaccines that work are just getting all put in the same old vaccines a bad bucket, and that's not right. That's my opinion.
Does that tie into some of the things around the food and beverage industry in your mind?
Not really. No, it's an independent public health because the diseases typically that you get vaccinated against are not ones that one associates with transmission through food for the most part. Although there are exceptions. Hepatitis A is a good exception. That is transmitted through food, and there's an effective vaccine against that. Yes. So there's a little bit of overlap.
Okay. So given all that we've discussed, what would be your assessment of 25?
It was a year of drama, excitement. I think it was prophetic in terms of its elements of change and impact on the food industry. I think it went into a lot of concern. Self-affirmed grass is going to go. Anything that's ultra-processed is going to go. The dietary guidelines are going to turn the world upside down. As 2025 got going, there was a lot of focus and noise. And it to some extent, some of that's continued, but some of it's fizzled a little bit, or it's become more tempered and it's become a bit more controlled and less, just less noise and more focus, if you like. But none of it has really gone away. I think the other factor for 25, and we may get onto this in a sec, is, we've talked about a couple of other factors in 2025 that were talked about heavily pre-25, like heavy metals. We haven't really touched on those. Lead, cadmium, arsenic, mercury in foods. Big focus before 25. Definitely mentioned in the context of Make America Healthy Again, of removing heavy metals. There's been a program at FDA to get those out of food, or reduce them in food, I should say, which is continued. But that has not been a big focus either of the current administration. That sort of train is just going at the same momentum as it was pre-administration. So it definitely was 25 was a year where there was just a lot of things on the table with not a lot of ideas as to where it was going to go. Now we have a better sense as where it's going.
Okay. Let's, in the essence of time, we got to move on to 2026. So let's start with, is there anything this year that you feel like is going to be unpredictable, and why?
That's a good question. Unpredictable. Well, how do you predict the unpredictable? The world of food safety is always unpredictable. And it's got nothing to do with politics. It's got nothing to do with administration. It's just got to do with the world of food safety. And I'll give you an example of that. Everybody on this call is going to be aware of a brand new set of circumstances which are unique. And that is infant botulism linked to infant formula. That's one I'm going to just mention there. Is infant formula has been around for a long time. And we're in the midst of, or hopefully we're now on the back end of, an outbreak of infant botulism that was linked back to infant formula. So that came out of nowhere. And the world of food safety is just full of examples of things that come out of nowhere that you don't expect. Things you take for granted and don't expect. Another good example, which will resonate with everybody, is when peanut butter suddenly became a high-risk food. And I'm going back a couple of decades there. I'm back 2006 when we first had a big outbreak of salmonella linked to peanut butter, and then we had another one a year or two later. But so that's the unpredictable side of food safety. Is something is going to happen. But there are predictable sides of it. We've talked about some of the 25 events leading into 26. And I certainly want to mention that while Maha and our conversation to date have been heavily focused on chemicals, heavy metals, I mentioned those, colors. We must absolutely not lose sight of the regular bugs that cause problems, Salmonella and Listeria particularly. And I think 2025 and going into 26 has demonstrated that there is no lack of aggression, and I use that term not to imply negativity, but regulatory aggression about going after Listeria, taking action, following up, taking it very, very seriously, and also Salmonella, especially in ready-to-eat foods. So that's not new. It's not anything that's dramatically different, but we mustn't take our eye off the ball of controlling those long-standing risks.
So one of my questions, you addressed some in your earlier answers. We actually we've had some submitted questions around GRAS, and we're getting more questions from the audience. So I'd like to actually kind of dig in a little deeper on this topic.
Sure.
We talked about some of the impacts, and one of the questions, right, is, and I think you alluded to it slightly, but let's make it clear, on the subject of GRAS, is that provision of self-GRAS at risk?
Yes.
Okay. Another question that we actually had submitted live is, we require submissions and reviews of ingredient product specifications. How would you determine if a certain ingredient is self-affirmed GRAS or not?
You've got to, well, there's two ways to do that. You ask the supplier of the ingredient, is it GRAS? And I hope they say yes. And then you say, by what means? If it's pre-1958, then that's history, and there's a lot of it. If it's gone through the FDA process, there is a website in which FDA lists all of their products that have gone through the GRAS process. So if you've got ingredient X, you can go into the GRAS database and determine whether that ingredient has gone through FDA GRAS notification. And if you see it on there, and you can download the information, and you can look at what it was approved for, accepted for by the FDA in terms of the amounts and the consumer. So there's number one, you ask your supplier, and number two, you can go to the database. And if you ask the supplier and say, yeah, it's gone through GRAS process, and you don't see it on the database, then query it some more. If you don't see it on the database at all, then it probably has not gone through the FDA process.
Okay. Are there any other areas that you see coming into play for 2026 that we haven't already discussed?
Not at this point. I do want to emphasize the standard microbiological risks. They are coming into play in 2026, and they're not going to slow down. They're not going to change. We've seen continued high use of whole genome sequencing and connecting illnesses, linking food products where the microbes have been found, or environmental findings in food plants with outbreaks and illnesses. And that database just keeps growing and growing and growing. So while it's fun to focus on the dyes and the GRAS and the ultra processed, we shouldn't do that at the expense of keeping our eye on some of these main long-standing risks that you have to control, because if you don't, the regulatory agencies will be all over you.
Okay. Moving into a little slightly different questions, right? With the FDA restructuring and potential resource constraints, how should the industry prepare for possible enforcement gaps or delay in inspections?
I've seen, in one regard, I've seen things slow down. An example would be when a company is under an import alert, and there's a need for sampling and testing of the product by a third-party lab, and then review of those results by the FDA before an imported food can be allowed to proceed, those processes do seem to be taking longer. And I think that that's probably a direct consequence of staff shortages. When it comes to on-site investigations, when it comes to inspections, particularly for-cause inspections, and this is a situation in which the FDA, say, has got some epidemiological evidence that a certain product from a certain manufacturer might be associated with illness. They are moving fast and sending in a bunch of inspectors. So the for-cause, I've seen it not slow at all. So the direct public health side of the FDA is working as efficiently, as effectively as it always has, which is why I'm cautioning people not to back off on the controls for the Salmonella and Listeria in ready-to-eat foods, because the FDA will be on you, and so will be FSIS. I think there are other aspects, and just to turn that back to GRAS, is that if there is a regulation requiring all ingredients to be reviewed by FDA that had gone through self-affirmation, that is going to create one heck of a bottleneck and there just aren't the people and the expertise to do it quickly. So with some regards, yes, I've seen impacts of changes at FDA. In other ways, no. When it comes to the tip of the spear, the hot stuff, the public health, the working on the outbreaks, that doesn't seem to have slowed down at all.
Well, it's interesting that how you mentioned maybe more being submitted to the FDA under the GRAS guidelines. Do you anticipate changes in how third-party audits are perceived or relied on with the evolving GRAS, and the food safety scrutiny?
No, I don't. I mean, the FDA, I think third-party audits will continue the way they have. And I mean, I'm sure the whole audience will understand when I say third-party audits are a mixed bag. Sometimes they're really good, and sometimes they give you a false sense of security. And I think everybody knows what I'm talking about. From a regulatory perspective, FDA could care less, I think, about third-party audits. It's companies that are doing that to help control their own risks. It isn't, so it really doesn't cross over into the FDA world. Only when you are relying on a third-party audit to control a supply chain risk, perhaps, and that third-party audit is lousy and it hasn't controlled the risk, and you get into trouble with the regulators. But no, I do see them as two separate things, and third-party audits come with their own set of challenges. That's a whole other FSMA Friday to talk about that one.
Oh, that's a great idea for a topic. With the essence of time, I want to make sure we're getting to some of the audience questions. So I'm going to switch gears a little bit and focus on some of the questions that have actually come through. You were actually mentioning this a bit around pathogens. And one of the pre-submitted questions was, why is there an uptick globally of LM incidences and more non-LM instances in food processing plants?
I think, I'm not sure I know the absolute answer to that, but I think it's largely because we're looking more. And I think so we're finding it when regulators are looking, they're finding it. And I think that, as I mentioned earlier, the use of genetics to connect Listeria over here with a Listeria over there, that science just continues to evolve and become more robust as connections are being made. So I don't believe that the risks have got dramatically worse. I don't think food plants have changed for the worse in any way. I think our ability to connect the dots has improved and discovery has improved, as has the focus of improved. And we talked a little bit about in the regulatory update is like the new information from the Food Safety Inspection Service. There's similar things going on in Europe. Europe are also putting out updates and changes around what they will tolerate in ready-to-eat foods that don't support growth for Listeria. So this is not just a US thing. Even in countries that have a tolerance, which we don't, there's a lot of parts of the world which will have a tolerance for 100 CFU per gram in ready-to-eat foods that don't support growth. The US doesn't have that. But even in those countries, there's more emphasis on controlling listeria outgrowth once products are in the marketplace. So whoever asked the question is right. The focus, the heat on these bugs is going up.
Actually, one of the questions that did come through chat was, we do not test for listeria species in the finished product, only environmental. Are they compliant, right?
Yeah,
just based on your...
It's a broad question, and I'm giving it a one-word answer. But there's a lot of it depends in that. But generally, yes. I mean, certainly in the United States, the requirement to do finished product testing, regulatory requirement, you have to do it, is not there. A lot of companies do it. A lot of customers require it. So if you're looking, and my personal view, and again, this is a David perspective, I think if you have got a really good environmental monitoring program, and I define that as you're doing a lot of looking, you're really seeking and destroy, and you're looking at zone 2s and 3s very heavily, I believe you can control the risk that way. But you've got to do it right. Then I think you're going to manage the risks going into finished product. But there are situations where you should probably be testing finished product, but that's usually an escalation. There's something that you've seen that is creating a risk. So it's not an absolute, but based on the simplicity of the question, I wouldn't say you're out of compliance if you're not doing it necessarily.
Okay. Another question around the FDA is setting better systems for surveillance of imported food. What else to do in addition to the FSVP due diligence, right? What are the foods which our regulations is not clear regarding that food safety expectation?
Well, the Foreign Supply Verification Program, or FSVP, that's a FSMA requirement. It absolutely puts the burden on the importers to check that the foreign manufacturer is regulatorily compliant. It's a good program, and it requires you to do a hazard analysis and look in depth. I think where it crumbles a little is not the way the reg is written. It's perhaps the way certain importers choose to follow through on the execution of it. And FSVP non-compliance has been one of the commonest causes of warning letters and 483s from FDA. It's right up there. It's one of the most common, and FDA is focused on that. But for a food plant, as you look at all your ingredients and all your suppliers, I'm a strong believer in risk ranking. And if you've got some of those ingredients that are really critical to you, or you use a lot of it, or it's got a bad history of causing problems, yeah, you can rely on FSVP from your importer, but my advice is to, scrape the surface off that and make sure it's robust and solid, particularly if it puts you at risk if there's a problem.
Okay. We actually have a little time, so I'm going to go back to some of the questions I did have prepared. If we think about how food companies should be thinking about risk transfer and continuity planning, right, as production footprints are changing, especially where institutional knowledge and best practices are being lost, what would you recommend people think about?
Well, that's a good point. I mean, institutional knowledge is changing. People retire, people move on. I think one has to look at, it boils down to risks. And, that answer, if you center it on a food manufacturing facility or a grower or a retailer or food service, then I think in today's world, it boils down to understanding where your risks are. And I'm really not saying anything novel or unique there. You've got define your risks. You've got limited resources to manage them, for sure. And some of that, if your institutional knowledge and way of doing it has gone, then one has to replace that by programs and policies and procedures. So it's driven by the policies and procedures, not by somebody's historical knowledge. And capturing that as an SOP or a policy, whatever that is in terms of controlling those risks, identifying those risks and controlling them, and then staying current, because as we've discussed earlier, I mean, the risks keep changing. So, you know, don't rely on your old risk analysis as still being current, because it might not be.
Any advice you can give to some of the manufacturers and processors who don't have a lot of resources, right? And they're trying to balance all these layered expectations, the different risks and regulations. Any advice there?
If you don't have the resources, you know, I think at the very least, try to look at your risk profiles to the extent that you can, and you've got to use some resources to do this, because if you don't, you're not even compliant with the regs, and that's a minimum requirement just to make food. So I think you may not feel like you've got enough resources to do everything that you would like to do, but nevertheless, whoever's regulating you, there is a regulatory platform that you've got to be on or above to sell food into interstate commerce, or at the state level into a state. That involves understanding risk. So, you know, just do your best to try to understand what that is. And then, you know, to the extent that you can leverage outside resources if you don't have them internally, then that's another way to go.
Okay. There's one other interesting topic going on in the threads right now that I wanted to bring up to see what your comments are. One of the listeners, the pistachios out there are failing after heat treatment. So the risk has gone up with the pistachio change. So many people are eating more Dubai chocolate and they are failing for LM. What are your thoughts on that?
Well, pistachios have got a history of having problems with salmonella, and it's typically a failure to adequately roast them or a post-processing contamination event. So if they're coming in heavily contaminated and your heat treatment isn't adequately controlling the salmonella risk, then take a look at your upstream supply chain. It's like, why are they coming in so heavily contaminated, if that's what the problem is? But if the heat treatment isn't working, you got to ask why. Why is it not working? And you know, is it ineffective heating for whatever reason? Is it a process issue, or is it a massive load coming in all the time that you're not controlling? So that's that side of it. The Dubai chocolate and LM, that's a new one on me. I don't know what that's about, other than just the general comments we've made about Listeria monocytogenes in a ready-to-eat food. You know, and again, I don't link LM a lot with chocolate as much as I do salmonella with chocolate. But whatever that unique issue is with LM and chocolate, I'm not aware of it, except like anything else that's ready to eat. There's always a risk that if your post-process environment isn't clean, you're going to get a bug on it, salmonella or listeria, that you don't want.
Okay, one last question and then I'll let you go. So 2 questions came in and they're around similar things, which is, what do you think the FDA is going to finalize the FSMA 204 language and actually begin to enforce it?
I don't know. I mean, that can got kicked way down the road. And as I said, in our first part of this FSMA Friday was GAO went after FDA for things they haven't done, and traceability was one of them. There's elements of the traceability rule which I think companies are having a real struggle on how to implement, and have naturally sort of made a lot of noise about that. I don't know whether the FDA will make some changes to try to make a little bit is better than nothing, and they'll back off on some things. I've heard no talk from the FDA about that. I have seen nothing. Maybe one of our listeners knows more and can share it, but other than they just move the date. And if they move the date just to give everybody to figure out longer how to do it, or they move the date to give themselves time to rewrite it, I don't know. At the very least, it's the first. But my personal view is I'd like them to take another look at it and try to get it to the point where it's more implementable. That's just my view, because we desperately need it. Traceability is so important. The Bioterrorism Act gave us one up, one back, which got us part way there, but we need a better way to track the whole
Holistically.
Yeah, from farm through to retail or food service. That's what's missing. And one of the big problems there, and the FDA can't fix it, is there is no uniform system to do that. There are some out there that do it, but they're not required. Everybody uses different systems. You know, we're all speaking different languages, and that just adds to the complexity. And it's costly.
Completely. To wrap it all up, any last thoughts, on how we should be proactive and stay ahead in 2026?
My last thought is going to go back to, if you're making a ready-to-eat food, don't lose out on the basics. Keep your eye. We talked about lots of potentials, lots of things that may go, but good manufacturing practices, make sure your HACCP plan and your food safety plan are current, based on today's thinking about risks. Focus on the workforce around those fundamental risks. They haven't changed. The consequences have gone up. The probability of discovery has gone up. So back to the basics would be where I would leave this. And let's see where grass goes. Let's see where colors goes. Let's see where ultra-processed foods goes. But don't take your eye off the basics, because that's what's going to do you in if you do.
Okay, focus on the basics.
Mm-hmm.
Well, thank you so much for joining us today, Dr. Acheson.